Hi, are you suffering from migraine? Let's talk about all you need to know in migraine. Migraine is the most common primary headache syndrome. It is seen in 10 to 15% of the people. Age of onset, it can occur at any age, but usually seen from teenage up till 40 years of age. Now, coming to the clinical presentation, it is not just headache and it can be studied in four phases. The first is prodrome, and the second phase is the aura, the third is the headache phase, and the fourth is the postdrome. Now, coming to the first, prodrome, it occurs in 3 hours to several days. Usually, we have yawning, changes in mood, lethargy, photo and phonophobia, food craving, and excessive thirst. Now, the second phase is aura, which occurs from 5 minutes to 60 minutes, and usually it is visual. You can have flashes of doubts or wayward lines or temporary vision loss or blind spots in the vision. Now, coming to the headache phase, it lasts from 4 hours to 72 hours. Usually, people experience severe unilateral headache, which is side changing and can become diffuse. It is usually associated with nausea and vomiting. The last phase being the postdrome, it lasts from 1 to 2 days, and people are usually unable to concentrate, and they have fatigue, and they are very tired. Coming to the management of migraine, it has investigations and treatment. In investigations, when you go to a neurologist, they will do a routine blood workup which includes vitamin B12 and vitamin D. The next, they will go for either a CT brain or an MRI brain. CT or MRI brain is usually normal in migraine. It is done to rule out other conditions. Now, moving to the management, it has lifestyle modifications and the medications. In lifestyle modifications, avoiding triggers is the main motive. Usually, headaches are triggered when you are hungry or sleepless. So, the first step is to eat on time and sleep on time. The next, we will discuss under food, sleep, exercise, maintaining a headache diary, and stress. Now, coming to the food, maintain a good hydration. Drink at least 3 to 4 liters of water per day. Lessen your carbohydrate and increase your protein intake. Limit caffeine intake to less than 2 cups of coffee per day. Now, avoid sweets or chocolates if your headaches are triggered with it. Avoid any food items if you are triggered with it. Now, coming to the sleep. Good sleep is required. At least 6 to 8 hours of sleep is required, and preferably sleep before 11 p.m. The next is exercise. Mild to moderate exercise, at least 30 minutes is recommended. Now, you can do any sort of exercise starting from yoga, aerobics, walking, jogging, resistance training, anything. Exercise releases endorphins which act as a natural painkillers. The next is maintaining a good headache diary. Maintain when you get headache, prodrome, aura, postdrome, everything. Write everything so that when you go to a neurologist, they will identify your pattern of headaches. The next is stress. Maintain your stress levels. Yoga and deep breathing will help in controlling your stress. The next is treatment. Coming to treatment, it is usually preventive and abortive. Preventive treatment mainly targets to reduce the frequency of headaches. It should be taken regularly irrespective of your headaches. There are at least 20 medications in which your neurologist will choose the best for you. Usually they are oral, needs to be taken daily, and more recently we have injectables which needs to be taken either monthly or 3 monthly. Though very costly, but very promising results are seen. Now, coming to the abortive treatment, it is given to relieve migraine pain. It works best when taken early at the first sign of the oncoming migraine. That means in the prodrome or at the aura, you need to take the medicine. Usually, pain relievers like naproxen, paracetamol, and many others are given. For those who are not better with these, triptans are added, or recently we have G-bands, though very costly but very promising results with good symptomatic relief is seen. Thank you and follow for more.